And while there is promising news on vaccines, the Biden transition is stalled, so is Congress when it comes to stimulus negotiations. And it isn't easy to get clarity on the administration's plans.
We will get through this, and we will get through this together.
Mr. Vice President,
Thank you all.
Mr. Vice President, you are going to take questions. Are you not ready to talk? Are you really not going to take questions?
All of you need to answer this.
Why is the federal government?
What is going on?
And you're not working with the transition. You're all part of not recognizing democracy. You're all undermining the democratic election. Every one of you.
Why is the federal
And you won't work with the transition.
What a scene. Peter, what is the story inside the task force? Is it fully functioning or adrift?
No, it's not fully functioning. It's barely functioning. It's, you know, the meeting, the public briefing was the first time we've seen them, obviously, in months. This is a president who hasn't met with them, according to Dr. Fauci, for months. Obviously, they wanted to put out that image this week of them at the podium, but they weren't willing to take any questions, either the vice president or any of the others. And the president himself, of course, has not taken any questions on anything since the election. And this is an extraordinary period right now. We've lost, since the election, probably 18,000, I haven't checked the latest number, 18,000 Americans or something like that have died of the COVID just since the election alone. That's an extraordinary death toll. That's 6 9/11s. And you have not seen the president take a leadership role on anything other than claiming credit for the vaccine. Now, look, the White House told us before the election that they basically given up trying to control the virus. And they put all of their eggs, in effect, in the in the vaccine and therapeutics baskets. But the thing is, even as promising as those vaccines now look, it's going to be months before most average Americans are able to get it. And there's a lot of hardship and pain and death between now and next April, let's say, when most Americans will be able to get that kind of vaccine. And we haven't seen the president take a leadership role on that at this very delicate moment.
Asma, what about the stimulus? President-elect Biden met earlier Friday with Speaker Pelosi, Leader Schumer. Is he trying to bring them together to cut a deal during the lame duck, or are they waiting until 2021?
He has said, and Democrats, have been insisting that a lame duck deal is the preference. Earlier this week, Biden did emphasize the fact that he wants some sort of COVID relief bill, and he emphasized the fact that that needs to happen now. So really, his urgency is on the lame duck session. I mean, I think the question that I have, and the question that I have posed to folks, but not gotten a clear answer from the Biden team is, well, does that mean that some sort of package, a quick package, takes precedence over the size of that package? And we don't have a clear answer of that. What I will say is that one of Biden's longtime economic advisors, Jared Bernstein, in a Q&A with some business reporters this week, did emphasize that speed, in addition to size and content, are all key factors for any stimulus bill. But he said that in his view, at least, this was, one of Biden's economic advisors, in his view, that speed is perhaps the most important factor right now, just given the fact that people are going to be entering the holidays with unemployment, expiration, and possibly being evicted from their homes. And he just felt speed was the most important factor.
Paula, what are you hearing on the stimulus? I'm told that Secretary Mnuchin and Speaker Pelosi, those are usually the deal makers, but they're not driving this at this point.
Exactly. It doesn't appear to be a priority here. We saw the Treasury has also started to roll back some of the relief programs that they had put in place earlier this year. And when it comes to the coronavirus and its economic impact, according to our sources on the task force, these doctors have made it clear to the vice president that this is a dire situation. Earlier this week, they told the vice president we could see up to 2,000 deaths a day by Christmas. It's easy to see not only the human toll, but also the economic toll. The situation is going to get worse, but at this point, it does not appear that any sort of economic relief is a priority here at the Trump White House.
Paula, a quick follow-up. Is the president still listening to Dr. Scott Atlas of Stanford University, who's been critical of governors and their responses to the pandemic?
Dr. Scott Atlas is still here at the White House. He does media appearances. He does not answer questions from reporters. And according to my sources on the task force, he will often attend meetings, but he will not speak. Some people suggest that perhaps he's there just to report back to the president. Now, these other doctors, though, they made it clear to the vice president that he and the president must get out. They must get out and get the message to Americans that they have to start taking measures to mitigate this spread. And I can say one thing of covering this for nearly a year now is the federal government has failed in its messaging to convince people that this truly is a threat and that they need to take it seriously. And now they have the challenge of trying to convince people to take a vaccine for something they haven't even convinced them is a threat. And there's a lot of concerns about the vaccine and how quickly it moved. The challenges are enormous, and it's just not clear how they're going to meet this moment.
And the Biden team has its own challenges. They're frustrated. Here is President-elect Biden this week.
If we have to wait until January 20th to start that planning, it puts us behind over a month and a half. And so it's important that it be done, that there be coordination now.
Peter, Emily Murphy at the General Services Administration won't allow the transition to happen. High-level intelligence briefings, federal funds. What does that mean for President-elect Biden?
Well, I think you saw the president-elect put his finger on it. I mean, in many instances, in many areas of the government, it may not make that big a difference because the team coming in just left 4 years ago. His team is full of people who have a lot of government experience. They know where the bodies are buried and how the system works. But the one area where it clearly has a great deal of urgency is on this issue of the COVID pandemic, and particularly the distribution of this vaccine. As he described it, of course, they need to be able to hit the ground running on day one to keep the distribution of this going and make sure it's heading in the right direction, because you can't afford even a day or a week of delay. That means every week of delay are people who are going to die as a result of it. So that's why there's a sense of urgency there. Here's the one sliver of good news, though, Bob, I would say. You saw the president take credit for the vaccine, and whether he deserves it or not, the point is he is invested in it. And that means, if assuming President-elect Biden is also invested in this vaccine, we may have a situation where politically, at least, it's not drawn on partisan lines, because they have to convince the public that the vaccine is safe and something that they want to take. And if you have both President Trump and incoming President Biden endorsing the vaccine, that will go a long way toward taking the politics out of that equation for many Americans.
And inside the Biden transition team, Ozma, do you see any kind of back channeling to try to get ready despite the GSA not approving a transition?
From what we've been told, at least as it regards to COVID, they don't have the information they say they need. One thing to Peter's point again is that he does, and he continues to work with a number of public health officials who were a part of the Obama administration. So there is expertise and know-how, but the challenge for them, they say, is that they don't have access to current real-time information. So they're relying on, say, the public dashboards that we all lay people rely on too for what's going on around the COVID crisis. So they don't have access, they're saying, to both vaccine deployment, but also clear information on, say, personal protective equipment stockpiles. And so they're trying to compensate for that in other ways. Earlier this week, Biden and Harris both met with a group of bipartisan governors, and they were able to get some information from those governors about what are some of the resource problems that they've had with the federal government and what are some of the stockpile concerns as well as vaccine deployment concerns. And so by speaking with governors, both Republicans and Democrats, they were able to get some of that information for us.
And Ozma, quickly, are we going to see any cabinet nominations next week?
Joe Biden hinted that we might see a Treasury Secretary announcement somewhere around Thanksgiving.
Paula, what are you looking for next week when you open your notebook?
Well, I'm looking to see what the president is going to do with his pardon power over the next 2 months. I'm looking at this every single day. This is incredibly significant because long before we knew the outcome of the election, someone suggested to me that if the president did not win, given his significant debts and his enormous, really blanket power to pardon people or commute their sentences, that there was a danger there, that there could be a lot of grift happening here. So we're looking very closely if the president is trying to pardon any of his friends, preemptively pardon any of his associates or family members, or if there is any sort of exchange or grift for people looking for a pardon, looking for a commutation.
I thought you were going to talk about maybe pardoning the turkey next week for
That too.
Thanksgiving. That too, we'll have to keep an eye out for that.